Welcome to Shah Medical Surgical. Today, we're going to talk about one of the most common concerns for parents, fever in kids. Is it always dangerous? What are the real causes? And when should you rush to the doctor? Stay with us as we break down everything you need to know in simple, clear language. Fever in kids is one of the most common reasons parents rush to the doctor. It can be frightening when your child's temperature rises, but in most cases, fever is simply the body's natural response to illness or infection. In this video, we'll explore the common causes of fever in children, the symptoms you should look for, and the warning signs that tell you when it's time to seek urgent medical care. What is fever? A normal body temperature in children is around 37 degrees Celsius or 98.6 degrees Fahrenheit. A fever is defined as a temperature above 38 degrees Celsius or 100.4 Fahrenheit. Remember, fever itself is not a disease. It's a symptom, a signal that the body is fighting something, usually an infection. Causes of fever in kids. There are many possible reasons why children get fever. The most common are viral infections like flu or colds. Bacterial infections can also trigger high temperatures. Some children get a mild fever after vaccinations. And in a few cases, overheating, allergies, or other conditions may play a role. Parents often think teething causes fever, but that's actually a myth. Viral infections, flu and cold. Viruses are the leading cause of fever in kids. Flu, common cold, and seasonal viruses can all raise a child's temperature. These infections are usually mild and self-limiting, but they can make children feel very uncomfortable and cranky. Symptoms of viral infections. When fever is due to a viral infection, your child may have a runny or blocked nose, sneezing, and a cough. Sore throat and mild body aches are also common. The fever is often moderate rather than very high. Along with these symptoms, the child may appear weak, irritable, and refuse food. Bacterial infections are general. Unlike viral infections, bacterial infections are less common but often more serious. They may affect the throat, ears, lungs, or urinary tract. These usually require a doctor's evaluation, and in many cases, antibiotics are needed for treatment. Symptoms of bacterial throat infection. In bacterial throat infections, children often develop severe sore throat and pain while swallowing. The fever is usually high, and swelling of the neck glands is noticeable. Because of throat pain, many kids refuse food or even water. On examination, white patches may be seen on the tonsils. Symptoms of ear infection. Ear infections are another common bacterial cause of fever in children. These cause sudden and often severe ear pain, especially at night. Kids may pull or rub the affected ear, cry excessively, and have trouble sleeping. Fever is present, and sometimes pus or fluid drains from the ear. Symptoms of chest infections. Chest infections, such as pneumonia, present with persistent cough, fast or difficult breathing, and high fever. Some children may complain of chest pain or produce noisy, wheezy breathing. They often appear very tired, restless, and visibly unwell compared to a simple viral cold. Symptoms of urinary tract infection. Urinary tract infections can also cause fever in children. In infants, signs include irritability, poor feeding, and vomiting. Older children may complain of pain or burning during urination, frequent trips to the bathroom, or lower abdominal pain. Parents may also notice cloudy or strong-smelling urine. Post-vaccination fever. A mild fever is very common after certain childhood vaccinations. It usually appears within 24 hours and lasts a short time. This type of fever is a normal immune response, showing that the vaccine is working. Parents should not be alarmed by it. Heat and overdressing. Not all fevers come from infections. Sometimes, overdressing a baby or exposing a child to very hot weather can raise their temperature. This is called environmental fever. Simply removing extra layers of clothing or keeping the room cool often brings the temperature back to normal. Teething myths. Many parents believe that teething causes fever. In reality, teething only leads to gum irritation and maybe a slight rise in temperature, but not true fever. If your child has a high temperature during teething, it usually means there is an infection, not just new teeth coming in. Other causes. There are some other, less common causes of fever in children. Allergic reactions may cause a mild temperature. Rarely, autoimmune or inflammatory conditions can trigger fever. Certain medications may raise body temperature as a side effect. Serious causes like childhood cancers are extremely rare, but they do exist. General symptoms with fever. Regardless of the cause, children with fever usually show similar general symptoms. They may become irritable and tired, lose their appetite, and refuse to play. Sweating, chills, and shivering are also common. Some children prefer to sleep more than usual when they are febrile. Warning symptoms, red flags. Parents should always watch for warning signs. These include a very high fever above 39 degrees Celsius, seizures, body stiffness, difficulty breathing, or bluish lips. Another dangerous sign is when the child becomes unusually drowsy, weak, or unresponsive. Red flags in infants. For babies under 3 months old, any fever at all is considered serious. Even a mild rise in temperature in newborns requires medical attention. Vomiting, diarrhea, or refusal to feed in young infants are also red flags. Parents should never wait in such situations, they must consult a doctor immediately. Home care, hydration. One of the most important things during fever is hydration. Offer your child plenty of fluids such as water, milk, or oral rehydration solution. For infants, continue breastfeeding frequently. Dehydration can make fever worse, so check your child's urine output and wet diapers regularly. Home care, comfort measures. To make your child more comfortable, dress them in light, breathable clothing and keep the room well ventilated. For very high fever, use lukewarm sponging to gently cool the body. Avoid covering them with heavy blankets, as overheating can make things worse. Medicines. Paracetamol, also known as acetaminophen, is the safest medicine for controlling fever in children. The dose must always be based on your child's weight and age. Ibuprofen may be used in older children, but never give aspirin, as it can lead to a dangerous condition called Ray's syndrome. What not to do? There are a few things parents must avoid. Never use ice water, alcohol rubs, or very cold baths to bring down fever. Do not give antibiotics without consulting a doctor. Avoid unproven or harmful home remedies. And most importantly, do not panic if the fever is mild and your child is otherwise active and playful. When to see a doctor. Seek medical advice if your child's fever lasts more than 3 days, if it keeps coming back, or if any red flag symptoms appear. Trust your instincts. If you feel unsure or worried about your child's condition, it is always better to consult a doctor. Prevention. Preventing fever starts with preventing infections. Make sure your child receives vaccinations on time. Teach proper hand washing and personal hygiene. Avoid close contact with sick people. A healthy diet and good sleep also strengthen the immune system, helping your child fight illness. To summarize, fever in kids is very common and in most cases, it is harmless. The majority of fevers are caused by viral infections and resolve on their own. Bacterial infections are less common but require medical treatment. The most important thing is for parents to recognize warning signs early. Always stay calm when your child has a fever. Give them fluids, keep them comfortable, and use safe medicines when necessary. Seek medical advice when the fever is high. Thank you for watching. We hope this video helped you understand fever in children, its causes, symptoms, and when to seek medical care. If you found this helpful, please give it a like, share it with other parents, and don't forget to subscribe to Shah Medical Surgical for more trusted medical information.